Well, welcome to 7 o'clock talk. Sorry for the messy car, but we just finished up with a 13-mile bike ride. We are doing a kids ride for cancer. We usually do this in September. This will be our fifth year for it. And I guess in the next 7 o'clock talk or two, we'll probably discuss that and put a link out to ask for donations. But let's, more importantly, let's talk about detoxing. Hopefully, here she comes. I want to cover what you should be doing before you detox. I want to discuss a safe way to detox, the pathway through detox, and um, just everybody wants to go straight to detox, and you really need to be healthy enough to detox. And people don't realize that it's very important to be using the restroom. Do you want to explain to them why it's important to be using the restroom regularly before you even think about detoxing?
And tell them what regular means.
Nope, sure didn't.
So you want to go at least every day, but you want to actually optimally go multiple times a day. And it needs to be soft and formed. And the reason why is if you don't eliminate every day, multiple times a day optimally, your body will actually reabsorb the toxins out of the stool and it congests the body, makes it very sick.
And so I'll put the Bristol stool chart in here just so you know what that should be and should look like. But Jessica is absolutely correct. You want to be going to the bathroom at least once, but generally 2 to 3 times a day, well formed, not diarrhea, not constipation. And that way you know that the pathway out is working. So the liver does, there are three phases to detox. Phase one in detox in the liver, the toxin gets activated. Generally, it gets a hydroxyl group added to it, and so it becomes a lot more active. And then your body will use the sulfurs from your vegetables, your foods, and then that starts to make it to where the toxin is now water soluble, it is less toxic, and now you can excrete it, phase three, roughly. And that's very, very important. People who are not using the restroom should not even remotely think about pushing the liver hard or the digestive system hard to try to detox. This is when people start to get headaches. It's when they get like the flu, they get sick. What other symptoms?
Bloating, um, um, abdominal pain, cramping,
And
a lot of gas.
and so those are the things.
Sorry.
Go ahead.
So if you're not excreting through your kidneys and your stool, then your skin will ultimately excrete. So you'll get rashes and itchiness and your dry skin, um, things like that.
And so one of the keys, and so why should somebody detox? There are several reasons to detox. If you've done tests like we just started a couple more patients in the functional medicine program, and we did a new test to us, and it showed a lot of metals in these people's bloodstream in their bodies. And you don't want metals like tin and aluminum and these things. You don't want them in the bloodstream. You want them to be excreted out. And the only way that you can do that, I mean, not the only way, but you want to get those things out because that will block your ability to make your hormones. It'll block your ability to make your neurotransmitters. It'll block the ability for your body to just work right. And when you have metals in your bloodstream, It can affect the way you think. It can affect your blood sugars. There's a lot of reasons you would want to detox, and good reasons. If you're estrogen dominant, you want to make sure that you're getting those old used estrogens out. And what's one of the most important things you need for that?
Did you talk to them about why that is? Because they recirculate.
No. Tell them what they need to detox, and then you can tell them why, or vice versa, however you want to cover it.
So why estrogen? You need to constantly cycle that out, and you get rid of that through stool. You need fiber. You need lots of water. And the reason why it's important is you need to make your hormones, use your hormones, and get rid of them in the same day. Otherwise, you'll recycle them. They get stored in the liver. They congest the liver, and they put you certain people. It's not healthy for anybody, but especially if you have different genetic SNPs, it
Put you at
predisposes you
risk
to risk for
for
cancers,
cancers, for certain types of cancers.
specifically in some women and men, breast cancers.
Breast cancers, estrogen dominant cancers. I think even in guys, estrogen dominance can cause some testicular cancers, isn't that? Because estrogen is an anabolic. It's a growth hormone, and so you definitely don't want the used up forms of
I
that.
don't know about the testicular cancer. I just know it predisposes people. I mean, I'll run down that rabbit hole, but I don't know at the moment.
And so, if you have outside things in the body that shouldn't be there, you definitely want to detox those. If you're having problems with your hormones, once again, make sure you're using the bathroom first. And then once you're regular, then you can start to actually detox the hormones out and get that estrogen dominance to start to come down if it's because you're not actually processing that out correctly. The next thing is you really shouldn't. One of the biggest things about detoxing and healing is stop putting the bad things into your body. And I consider, let's preface this by saying we actually do everything that we tell you. So when we say we don't eat extra sugars, we don't even have sugar in our house. But I am predisposed to diabetes. I am really predisposed to that. But when I eat sugar, it just leads to bad habits. It leads to me overeating, and even overeating,
Zero control.
even a says Chip Girl.
I don't have a sugar problem.
You don't?
I don't buy chips often because I do like to eat them.
But, and so we both know these things. And so we don't bring these things into the house. Plus, anytime you're looking at processed foods, I know how my body works, and my body does not work well with processed foods.
Well, and even if they're healthy versions of processed food, they're still processed food.
Yep.
So even if they're organic, even if they are manufactured by a machine in a plant somewhere, it they're just not good for you.
And if you don't believe me, go look at our last video and you will see that we have had all kinds of experimentation on ourselves with a glucose monitor, just watching what those things do to our bodies.
Well, and then also you can do every single thing right, and sometimes your body just does not work with you, or you're just genetically predisposed to do something different. So don't be too hard on yourself. Like, you will learn a lot about yourself.
Absolutely.
Sometimes you just can't fix certain things.
Yep. Depends on how wrecked the car is. Because, if a car is totaled and bent frame, you're never going to get the frame straight. So then you have to learn how to work with it. And that's the same with the body. I mean, the body wants to heal, and detoxing stuff is good. So a detox from sugar, a detox from soft drinks, a detox from foods that are people. It, the amount of hormones that are in conventionally raised foods are not good, and they are definitely not good for you. And you really have to get away from those types of things. And some things like chemicals, it's so hard to get away from chemicals. We're currently working with Kelly Ryerson, and we will have a podcast done with her. We've already recorded 1 hour with her, and I don't know how long the second one's going to go, but it is absolutely atrocious what our food system does to us. And the five most toxic foods that you can eat: wheat, oats, beans, soy, and what was the last one? Because it was one I didn't think of. Well, I think I covered them all. So there's four. But if you're eating those and they're basically conventionally grown, you should probably do a urinalysis and look for glyphosate in your urine. And if you have it, you need to detox from it. And part of that is not putting more of that into your body. And so that's one of the things with detoxing. You have to stop adding to the burden. We had two people, like I said, that just started with us, and they didn't have really high metals for any one. I mean, they did for one, but like it wasn't outrageous for any one.
But you shouldn't have any metal.
Yes.
It should be zero. So any metals are not good, especially if you have multiple ones, even if you have very low levels of them. They add up.
And that's what these people had. They have multiple metals. And what can this look like in you? Well, that can look like joint pain. That can look like hormone dysregulation. That can look like brain fog. That can look like uh, erectile dysfunction. I mean, it can affect your body in so many different ways. And that's a reason why you should be detoxing. But we can't push the detox button on that gentleman yet, or hard, because he's not going to the bathroom. If you're not going to the bathroom, and you're going to hear me say this over and over in this presentation, if you're not going to the bathroom, this stuff is just going to back up and recycle and wreak havoc in you. And so those are reasons to really start to clean up just your diet so you don't keep adding to the body burden. And then once you have actually cleaned up your diet and you're no longer adding to the body burden, then you can start to look at getting rid of the things that are floating in your system. And how do you do that? What does that look like? Well, it kind of looks like you got to know what you're trying to detox. And does your body have the ability to make the detox chemicals? Can it make your glutathione? Can the liver go through the processes it needs to do to make sure that the toxins are water soluble? Can your body do that? Because it's one thing just to give somebody glutathione, and if they're not going to the bathroom, or they don't methylate, or they don't have methylated bees, then that that creates nuance in the ability for that person to detox. Your hormones have to be pretty good when you're trying to detox, because your cells depend on insulin, and they depend on estrogen, and they depend on all of these components to be healthy. And so I would say at this point in time, when you're detoxing, what are you detoxing? Are you using the bathroom? If you're using the bathroom, then you can start to go to those detox teas. Then you can start to do, you know, fasting, and you can do a lot of things that allow your body to actually detox. And then, if you know you methylate, great. B vitamins are a must, amino acids are a must, but then you must also probably give your body some extra glutathione. If you don't know if you produce glutathione well, you really need to make sure that you do. And you got to give your body the precursors to glutathione. You can give your body glutathione, and then you also have to be kicking it out.
Well, and if you're super sensitive to things, you need a binder, and you need to be very careful because you do not want to release toxins into the body that you can't eliminate because they will make you very, very sick, and then you will reabsorb them. So you have to get a binder and get them out if you're super sensitive.
And if you're not using the restroom, I mean, if there's one thing that anybody that wants to do a detox should take away from this, that one thing is make sure you're using the restroom. Look at the Bristol stool chart. As funny as it sounds, grade your stool, and then you can go from there as to whether or not you think you're ready to detox. Anything else you want to add to that? We hopped around a little bit, but if you're going to use things like glutathione and amino acids and you're going to push these things,
I do have something to add.
I would highly recommend doing a little bit of testing. Get your organic acids tested. And it's not a super expensive test. You can get your organic acids tested, and that way you can see if you have the precursors. You can see if your body's actually processing and doing what it should. Go ahead.
Well, just a simple thing. If you're not sure if you're a good detoxer or not, there's just this little simple thing. If you sweat.
Yeah.
So for a lot of people, they don't sweat. And there's people that just like go out and they just like pour, they just like drip. They're actually pretty healthy if you can go out and you're doing your thing and you're just pouring sweat and you get wet hair. Your pathways most likely are better than somebody's that did not.
So if you have any questions, feel free to drop them in the YouTube and we will get to them. I usually get to those questions within a day or two. We're happy to answer them. And with that all being said, y'all have a wonderful evening and we'll see you next time.